Senator Francis.
Thank you, Mr. Speaker. Senator Gold, yesterday it was announced that the federal government will provide $2 billion over 10 years to address the unique challenges Indigenous peoples face when it comes to fair and equitable access to quality and culturally safe health care services. In light of the criticisms from Indigenous leaders who are excluded from discussions on health care funding, could you please provide us with a detailed list of all the, and I quote, Indigenous partners your government plans to work with to prioritize investments, as well as with a detailed breakdown of the how and how much this funding will be dispersed directly to First Nations, Inuit, and Métis across all provinces and territories?
Senator Gold.
Well, thank you for the question. It's an important one. I clearly don't have the answer. And part of the reason is that the government is going to be working with Indigenous leadership and communities to make sure that that the money, and this is a historic and first-time initiative, which the government is proud of, but is done in the right way and that meets the needs. And in fact, a number of us today had lunch with the Minister, at his invitation, the Minister of Health and also Minister Bennett. And this subject was discussed. Our colleague, one of our colleagues who's not in the chamber, so I should not mention her name, but raised this directly, and there was a clear commitment and understanding on the part, and I'm looking for colleagues who were there to verify what I'm saying. But no, you weren't invited. It wasn't me that extended the invitation, Senator Platt. But what I'm saying is that those who were there, I think, can attest to the fact that the government is committed to working in a serious partnership way with the communities, and it's going to take some time to develop those plans and make sure that the assistance that the money can provide is really meets the needs of the individual communities. I'll make some inquiries. I don't think I'll have an answer quickly.